Welcome to Fields of Study from the Masonic Cancer Center. Today, we sit down with Dr. Shernan Holtan. Hello and welcome. My name is Max Huber, and this is the latest edition of our series with some of our faculty and staff with the Masonic Cancer Center. I'm the Communications and Marketing Manager here, and we want to sit down during this time when some of us are in a non-traditional workspace. I happen to be in my basement right now because of the whole coronavirus COVID-19 situation, but we're making the best of it, and we want to highlight some of the research and some of the work that some of our great doctors and researchers are doing. So I'm pleased to be joined today by Dr. Shernan Holtan. Dr. Holtan, thank you for joining me.
Absolutely. I am joining you from my bedroom. I have a closet office in our bedroom, so definitely an unconventional space for an interview. Had never envisioned that this would happen.
But you're not always stuck in the closet during this time. You're still going into the office or going into the clinic to take care of patients. Is that correct?
That is correct. Yeah, so I do have a clinic once per week, and then I attend on the hospital service as well, usually around 2 weeks every other month or so. So I have not been in the hospital recently, but I'll be there in about 2 weeks when we're expecting to have some peak COVID time in Minnesota.
And how has the whole coronavirus COVID situation affected some of the patients that you're seeing, or just in general with some of the colleagues that you're talking to?
I mean, honestly, it has changed our medical practice completely in about 2 weeks. Some of the changes are really positive and I think should have happened a long time ago, but I'm glad that they're here for the convenience of our patients and the safety of our workforce as well. So yes, I have clinic about once per week, and about 80% of my clinic visits are now done virtually, either on the telephone or video. Which is awesome. I think it's really great for patients to receive our services here in blood and marrow transplant, to be able to stay where they are, get their labs done in a place that's convenient for them, and then have our visit be virtual. So I think it's a terrific service that we can provide. Not the same as an in-person visit for sure, but I think this is a really awesome change for them and for us.
Yeah, I mean, it shows the adaptability that some of our faculty and staff have. And just you see that in just different groups like distilleries converting from making alcohol to making hand sanitizer. It's just people at this point have had to adapt, and they're learning to adapt, and that's great.
Definitely.
Speaking of adaptability, in terms of the research that you're doing on that side, how has this whole change affected what you're doing there?
To be honest, it's all consuming. It's the first thing I think about in the morning. It's the last thing I think about at night, is how COVID is affecting our patients, our healthcare providers as well, our families. It's pretty much all I can think about, which is a drastic change from just a few weeks ago, where we had just been starting to hear about this. So essentially what's happened is most of my regular research has halted, and I just stopped and thought, what can I do to help in this situation? I feel like the only way that I fail myself and my university and my community is if I have an idea and I don't act on it. And so what I actually did back on March 21st, which feels like a lifetime ago,
Yeah.
was I wrote a clinical trial to address one of the fatal complications of COVID-19. It's been recognized that some of these patients develop what's called a cytokine storm, or excessive inflammation in the blood. There are very high levels of a number of inflammatory markers, and a clinical picture that's a lot like some of the very bad inflammatory conditions that can arise as a complication of some of the treatments that we give in blood and marrow transplant. And I thought maybe I can use some of the tools that we use in BMT to help address some of these potentially fatal inflammatory syndromes in COVID-19. So most of my research is focused on graft versus host disease. This is a potentially fatal complication of allogeneic hematopoietic cell transplantation. Most of my patients have cancers of the blood or disorders of the bone marrow. Having seen another complication of immune effector cell therapy called cytokine release syndrome, I thought some of these syndromes seem to have parallels with this high inflammatory state in COVID-19. I wonder if some of the tools that we use in BMT might be useful to the community that's dealing with this pandemic. And so again, back on March 21st, I wrote this clinical trial to try to address this hyperinflammatory syndrome using some of the tools that we use in BMT. I basically stayed up all day and all night, glued to my computer, writing this clinical trial, collaborating with our statisticians, asking opinions from some experts in the field, and thinking, how can we in BMT lend our tools to address this problem? So we wrote the clinical trial, and this was one of my potential failures in my career. It didn't pass the Office of the Vice President of Research Tier 1 system. So the bad news was this trial couldn't move forward in Minnesota. The reason is there were so many people who had applied for what they call Tier 1 clinical research that they really had to think hard about prioritization and finding ways to reach the most number of Minnesotans with the research. And my study was a relatively small phase 2 study. So what this meant was it couldn't move forward for me, but it was because of the amazing response of the University of Minnesota in general. They had so many ideas that, you know, we're still going to do groundbreaking research here and hopefully make a big impact on this disease. It's just not going to be my idea. So what I did with that was I thought, okay, well, if this is not going to help Minnesota, maybe it can help some of my friends. So I reached out on Twitter and said, hey, Twitterverse, I wrote a clinical trial. I have a concept to treat hyperinflammatory syndrome and COVID-19. Is anyone potentially interested? Could this be of use at your institution? And in about 24 hours, 7,000 of my closest friends had viewed it. And the protocol concept went around the world. And I am very hopeful that some friends that are involved in very dire situations in their hospitals are going to be able to use this trial. And so I do know that it's going through the steps to open at one of the COVID-19 hotspots in the country right now. So although this idea can't help Minnesota, my hope is that it could potentially help someone else somewhere else, and we can all still learn from it.
Kind of a little blessing in disguise. Yes, you would love to help the people in the state that you live in, but this could end up having an even greater impact. Like you said, the power of social media, which I know that you're very active on, you're able to get this information out there to some of your colleagues throughout the world. And it's got to give you some hope to see the fact that that people have picked up on this, and that you might not get to actually do it, but you're seeing your work and your research put forward at other places.
Definitely. I see right now how much the field of blood and marrow transplantation and immune effector cell therapy, a lot of the work and inflammation that's been built around this for many decades, might really help those people who are on the front lines dealing with COVID-19. You know, that's what it's all about. It's not just about my research. It's not just about my university. It's about our world and doing whatever we can to contribute in this really unprecedented, crazy time.
Yeah, and pivoting back to cancer, I've heard our director, Dr. Yee, mention this many times, that not one single person is going to end up curing the problem of cancer or finding the solution to the problem of cancer. It's going to take lots and lots of time, lots and lots of people, lots and lots of money, and lots of energy. So yes, there might be one person that sparks that, but it takes this whole world, this whole universe to kind of work together. And in terms of your cancer research, you mentioned the inflammation. You do a lot of work in what you like to call inflammaging. Talk about that and some of the interesting studies that a lot of us at the University of Minnesota are very excited to talk about because of the visual aspect of some of the things you're doing.
Yeah, definitely. So inflammaging, I can't take credit for this concept. It's been around for decades, but it's the concept of inflammation driving accelerated aging. And we see this very much in cancer survivors and those who have undergone blood and marrow transplants. Biologically, we can identify multiple mechanisms that show that the aging process is accelerated. If we do a variety of blood measurements, we can see it in the blood. But, you know, even more striking is just my patients in my clinic. They tell me, I feel like I'm 100 years old right now. You know, I can take a 25-year-old to a transplant and see that in, just a few months, he or she is aged decades in terms of muscle mass loss, quality of life, and just kind of the general vitality, energy levels, fatigue. You can just see it happen before your eyes, even without a biological test. So knowing that this is such an issue for our patients, I've been really struggling with how to address this very widespread problem. In fact, it's such an obvious problem that we don't even see it before our eyes sometimes. It just happens to everybody and we forget about it. We think it's a normal part of the process. But my patients don't accept that. They want their lives back, so we shouldn't accept that on their behalf. How can we help? There might be some medications that are being developed in collaboration with our Aging Institute here that can help reverse this problem that we see. But as far as I can tell, there's nothing better than actual good old-fashioned exercise for this. So that's one of the clinical trials that I've been most passionate about. Unfortunately, it's one of the clinical trials that's on hold right now because of
Kind of have to do that in person.
You do, yeah. So to help address inflammaging, we have developed a clinical trial that centers on strength training for cancer survivors, but we've built in a couple of pieces to this clinical trial that we think are going to help make it something that people can adhere to for forever long term. So we developed this in conjunction with my own weightlifting coach, Jason Sweetnam at Lifetime Fitness, where someone who has recovered from chemotherapy or transplant can join this study, but they have to come with a workout partner. They have to come with a friend or a relative who will be there with them the whole time. They'll also get trained. And so as a couple, they receive personal training, but then that's also done in the context of a small group training that meets once per week. So it's this interesting combination of individualized, personalized training. It's like everyone gets their own exercise prescription, but it's done with a partner in the context of a larger group. And what we hope that builds is a bit more enjoyability when you're working out with a friend or a family member. They help to inspire and motivate you. And also call you out if you're just doing half reps. They'll say, nope, not good enough. Show me the full rep. How else can we engage and make exercise fun that they would want to adhere to it for forever? We don't think that it's quite as fun interacting with a trainer on a computer screen as it is in person.
Yeah.
That personalized touch is so important to the success of the project, we think. So we'll have to see what we're able to do once the gym is able to open back up and our patients feel safer returning to the gym again.
And on a personal note, you and I go to the same gym. I don't throw around as much weight as you do, but personally, how are you taking this, not being able to go to the gym as it's shut down? I know that a lot of people have gotten outside and gotten into running, maybe if they haven't, or just other forms of physical activity. But how are you, somebody that likes to lift heavy weights, how are you adjusting?
I'm doing okay. I do have some weights at home. I have a few bumper plates and a barbell, not too much weight. So unfortunately, I have to do high volume training, which is kind of gross. A lot of reps. It's just not what I am used to. But I'm able to do that. I have a kettlebell and some dumbbells, so able to do all kinds of self-destruction with those types of accompaniments. I have a stationary bike that's not fun to use, but I do. So with some creativity, I'm able to work on some strength programming where I don't think I'm taking too many steps backward. But I have had to focus on more volume and then more cardio, which I've been telling my coach for months now that I think I don't need to get any stronger for my health. I really don't. I don't have to lift more weights to be healthier, but I should work on fitness and the cardiorespiratory aspect of things, which I've admittedly really neglected because it's not as fun for me. So yeah, you might see me out there running from time to time. It has happened. I have done some running.
kind of like a unicorn again, and maybe another blessing in disguise. You've had to adjust and shift course on this.
It
Uh,
is.
yeah, a couple more questions, and not that you aren't busy enough being a researcher, being a doctor, having a family, but you also in the summertime were named the medical director of the Cellular Gene and Immunotherapy arm of the Clinical Trials Office. So what does that mean, and what responsibility have you taken on with that position?
Yeah, that has been amazing, actually. So, within our group of blood marrow transplant physicians, we've been able to develop clinical trials that address treatment for all kinds of cancer and bone marrow disorders over the past several decades. In fact, as you know, the University of Minnesota has led some of that effort worldwide. And we as a group have been doing these types of treatments for over 50 years. So some of the cell-based therapies and immunotherapies that have been developed for BMT and cancer treatments in the past, we think might be extended to those who have COVID-19 or other diseases as well. So our group is able to connect with disease experts outside of cancer to see if we can bring some of these cell therapies to a whole new group of patients to hopefully benefit the community at large.
Very cool. And I always like to end with these, and this is a very like existential brain busting question, but with all the things that are going on in the world and all the things that you're doing and that you're seeing your colleagues, whether that's here at the University of Minnesota or around the world doing, what gives you hope?
What gives me hope is honestly just the uh, ability to adapt and also use tools that we have immediately available to us. So as you have seen through research coming from the University of Minnesota and other places, the concept of drug repurposing is really hot right now. We already have drugs that have promise but need to be tested in clinical trials. We saw that happen in graft versus host disease with my research using pregnancy hormones to treat bad GVHD. We at the University of Minnesota and other places are repurposing drugs to address the issue of COVID-19 and the devastation that's happening throughout our state and throughout our world. So the thing that gives me hope is how quickly people are able to act and use the tools that we have at hand while the scientists are still in the lab developing vaccines, developing tests, developing the newest generation of therapies. We have things that we can do today. And our group has been extremely organized in addressing just that. What can we do today while the scientists are helping us deal with the problems of tomorrow?
That's awesome. You can find her on Twitter at SGHMD. That's SGHMD on Twitter for all of her weightlifting escapades, for all of the insights into being a working parent and a mom, and you know, maybe running. Maybe she's going to post some running pics, but
Max, maybe.
maybe. Okay. Well, Dr. Holtan, thank you so
Really
much
well.
for joining us. This was an absolute pleasure, and I look forward to being able to see you and the rest of our colleagues in person very soon.
Thank you. So do I. Thank you for this opportunity. It's great to see you again, and I think we're all doing what we can. So thank you for the chance to share.